Okay, we'll get started in just 1 minute. Welcome, everybody, and good afternoon. Thank you for joining us. Hope you guys are all staying cool. I have a couple of people I see who have hands raised. If you have a question or a comment, shoot that to me through either the chat, through the host or panelist section, or on the Q&A section, please. I'm just going to go ahead and get started with our little opening so I can get these girls on their way. Most of you have probably joined us before, so you know the drill, but here I go. Who is Mission West Virginia? Mission West Virginia is leading a statewide effort to promote positive futures for all kids in West Virginia. We work alongside families as they navigate West Virginia's foster care system and provide evidence-based life skills education to help teens envision and create positive futures. As a result of our work putting kids first in collaboration with social services, school districts, private foster care agencies, and other nonprofits, the future looks brighter for West Virginia. You can learn more about our organization at missionwv.org. So we do this through two main programs. The first is Frameworks. Frameworks provides support for those interested in foster care or kinship care to understand the system, find a placement agency, and prepare to make a meaningful difference in the life of a child. If you're interested in learning more about how to become a foster and/or adoptive parent in West Virginia, you're in the right place. If you'd like to speak with someone on the phone, please call 866-CALL-MWV or 304-512-0555. You can also request an information packet on our website at missionwv.org/request-information. The second program that we have is the Think program, which is what is hosting today's webinar. It stands for Teaching Health Instead of Nagging Kids. Miss Natalie, who's presenting, we are excited to welcome her back. She used to be part of our Think program, and we miss her so much. So Think empowers teens to make positive life choices through education, life skills, and coaching. Our program is evidence-based and helps the students we work with navigate the social emotional pressures all teens face as they develop. This includes building healthy relationships and healthy choices around drugs and alcohol and pregnancy prevention. We deliver our program in partnership with schools in 20 counties. We're vetted by district leaders, teachers, and other school leaders who are trained to work with kids. The program's evidence-based curriculum has been shown to have a positive effect on preventing teen pregnancies, sexually transmitted infections, or sexual risk behaviors. Our educators are continually trained on the most up-to-date information on trauma, sexual health, and high-risk behaviors. Our management team does on-site observations of our educators regularly to ensure fidelity is being followed. We also administer pre and post surveys, receive teacher feedback, and hold teen focus groups and site satisfaction surveys. Another way that we help reach out and do our training is through workshops and trainings just like these today, because we know it takes a whole community to help teens envision and create positive futures. So this is why we also provide resources and training to equip parents, families, and the individuals who support kids as they navigate their teen years. Some of the types of workshops and trainings include talking to youth about sensitive or hard topics, hidden in plain sight, trauma, sexual assault prevention and consent, teen dating violence, and then, of course, webinars like these, we do a range of topics. So we do provide social work CEUs for our webinars and some of our trainings. CEUs for this webinar are offered for social work by Mission West Virginia. Our provider number is not 49999. It'll be in the chat box. It is actually 490129. Attendance is verified through Zoom. If you are part of a group watching this on one person's account, please shoot us an email so we know who the individual participants are, so you can get your CEU credit. That's only if you need CEU credit. We request all participants to fill out a follow-up survey. There will be a link to that at the end of today's webinar, but it will also be placed in the chat box. And certificates will be processed. This says 72 business hours. Becky is on vacation this week, so look for it some point next week. If you do not receive it within a week, week and a half, then please reach out and let us know. All right, let's meet our speakers. They're going to actually introduce themselves. But we have Natalie Stotts, who is a truancy diversion specialist with Kanawha County Schools, and Kim Legg, who's the lead attendance and social services director. And I hope that I got your title or
Yes.
titles correct. There we go. All right, I'm going to stop sharing now and hand this over. Thank you guys very much for this today. We appreciate you. hopping on and spending your summer with us.
Yes, thank you for having us. Um, we were just talking about hopefully this training will be kind of informal, just because it's summer and we hope that you're having a great time. Hopefully relaxing a little bit at some point. So we're going to get our PowerPoint up here in a second. But today's talk, we are going to be covering the ACEs, or Adverse Childhood Experiences, and how we in the school system can help with those. And of course, building resilience. So let's
Trying
see.
to get this shared. Is this sharing slideshow? Are we screen sharing? Hillary, are we good?
You are good to go. Everything looks great.
Awesome. We were worried about that. Technology is not our strong suit, so
We got it.
we got it. Yes.
Yay. Okay. So, like I said, today's talk, we do want to give you an overview of ACEs, but also talk about what that looks like in a school system. So,
So yeah, we'll go ahead and
Introduce
introduce ourselves. My name is Kim Legg, and I'm the Director of Attendance and Social Services with Kanawha County Schools. I've been in this position for about a year, July 1st, but before that, I've been a social worker with Kanawha County Schools for 21 years, and I've worked with lots of students and families and lots of ages, and I've been active in the ACES Coalition for many years, and when I got this job last year, we really are looking at students with trauma and how that affects attendance and their academics and all of these things. So we've really worked hard this year to have our principals and teachers kind of look at students through the lens with an ACEs understanding. So that's what we're going to kind of help you guys understand today, and hopefully you can spread that message along to your folks you work with.
So my name's Natalie Stotts, and I started my career with DHHR. So I saw a few of you comment that that's where you were from today. So I did youth services in Kanawha, Boone, and Logan for about 8 years. And then I worked for Mission, West Virginia, which I thoroughly enjoyed, loved that, and I miss it very much. But I am getting ready to start my 7th year here with Kanawha County Schools, working as the truancy diversion specialist. So I am not an attendance director, but through some new legislation that was about, well, I don't want to say new, it's about 10 years old now, but the law mandated that we do diversionary programs with our juveniles. So that's what I run here for Kanawha County, and I'm also part of the ACES Coalition.
And it's very unique with Kanawha County Schools. A lot of my colleagues around the state that are attendance directors, they have multiple jobs. That we are very fortunate in our county that we have 27 of us total in our department that can go out and work in the schools with families. We also have homeless facilitators. We have Title I social workers. So Kanawha County is very, very fortunate and grateful for all the support that our Board of Education allows us to help our students and families. So we're going to go ahead and dive into the content. And like I said, we're going to kind of give most of y'all already know about ACEs, but we're going to kind of give a brief overview and kind of talk about resiliency, because I think, having hope, when we work with students, a lot of them have just been so beat down. Their parents have been beat down, and a lot of them, it's not really an attendance problem. It's they're just hopeless. It's a hope problem. So I think a lot of y'all know about ACEs and all that. We're going to do a quick overview, and then, like I said, talk about resiliency and talk about what we've done in the last year in Kanawha County Schools since I took over. We've had great successes, and hopefully it can help you with your county.
So one of the things, in addition to that we just wanted to bring attention to is some of this information. If you haven't heard of ACEs, or even if you have, some of this information, might be difficult to hear about or to talk about, might hit close to home. So please do, make sure that you are talking to your support people in your lives, and seeking help if you need it. Okay. But like Kim said, today we want to talk about resiliency and the ability to adapt. Okay.
So first of all, let's look at ACEs. And I saw something online a while back, and it said, instead of looking at student test scores, how about looking at their ACE score? And I think that hit me so close to home, because I think, a lot of times people are looking, well, that school is, they didn't do this and they didn't do that. But I think we need to really look and see, what are kids going through? What's behind the scenes, what is happening. So ACEs is kind of categorized into three different areas: abuse, neglect, and household dysfunction. So there's this physical, emotional, sexual abuse, physical, emotional neglect, mental illness in the home, if a parent is incarcerated, if the mother's treated violently, substance abuse, and divorce. So, I mean, many of us in our profession and many of our students, might have one or two ACEs. And, I think a lot of people are doing these screenings. I know the doctor's office that I go to, they actually do an ACEs screening on every patient that they see. And I think this is just very good information to look at when you're looking at a student or looking at a family and trying to navigate what can we do? What can we do to help that? So this is kind of the screening tool. It's a 10-question screening tool, and that's how you get your ACEs score. So, you'll see us referencing here, this person had an ACE score of 7. This person had an ACE score of 4. So this is kind of the context from where that's coming from. So just kind of keep that in mind as we move forward from here. Okay.
So the ACES study, for those of you who haven't heard of it before, did come from a study that was completed in 1998 out of California. It was actually done by an insurance company, or funded by an insurance company, I should say, to try to see why people were having physical health problems later in life. Like, was there an underlying reason that this was happening? And it looked at, childhood trauma and how it ended up, when they looked at it, it was very common. Even in populations that we might stereotypically say, oh, well, that's an okay class, middle class, white Americans, working, it didn't matter if childhood trauma and abuse and things were in every one of those groups, no matter, who they were. So they looked at it and they saw that obviously there's a direct link between that childhood trauma and what happened to those children once they turned to adult age. And these things included chronic disease, depression, suicide, being violent, or being the victim of violence. Obviously, the more trauma or the more ACEs that you have, the more likely you are to have adult issues as an adult that might come on. So the original ACEs study obviously only looked at those 10 categories that Kim had just talked about. But as we know, as you probably know, working in the field, there are a lot other areas that can be very traumatic for children. Things that aren't on the ACEs study, like the death of a sibling, or serious childhood illness like medical trauma, or floods, fires, community violence, lots of things that kids could be, witness to or victims of that could cause, an ACE score that maybe not would show on that 10 question.
Right. And especially in West Virginia, I mean, I think we've had, lots of natural disasters happen, the flooding, things like that. I can think the derecho that happened on June 29th. I can think of my son in particular. We were in our pool and the derecho hit. And to this day, he's 21. He's like, is that going to be like the June 29th storm? So
Yes,
things like that can affect, where it rains and people have been flooded. They just kind of have these traumas. So West Virginia, I think, have definitely had our fair share of issues with those types of things.
For sure. So, like I was saying before, having a high ACE score can affect all of these different things in a person's life, right? And if we look at that systems theory of everything affecting everything else, so your physical health, your mental health, even how you relate to other people in your relationships, what we're doing in the workplace, how we're doing at school, it all has an effect on that. And even in the school system, we have a lot of grandparents raising our students. So it's our grandparents' ACE score, it's our parents' ACE score, it's our children's future ACE score that all is having an impact on these students and their current situations.
Exactly. So looking at the ACE score, like I said, that score is important. If you have an ACE score of 4 or more, you are 2 times likely to be a smoker, 12 times likely to attempt suicide, 7 times likely to be an alcoholic, and 10 times as likely to use injected street drugs. So that's pretty significant. In our county, we have lots of students that have issues. We have a committee that meets with these students, and this is my first year being on that committee and sitting down with those students. And every single one of those students who were in academic trouble, who, had truancy, who've been in, the judicial system, every single one of them had an ACE score of 4 or higher. And that just really hit home to me this year, thinking, what are we doing as a system, as a school system, to try to build some resilience, to try to give them some hope? Because you ask them, what do you like to do for fun? Nothing. What do you do in your spare time? So, we have to be more, aware of what these students are going through. And I think, as the social service staff, we're great. We have social workers, we have counselors, psychologists. We are great, but there's very few of us. So what our goal is really to try to educate teachers, educate principals, educate the cooks at the schools, educate the custodian, to really be aware and hyper vigilant of what these students are going through. Because, as you'll see later on, this resilience, it can be one caring adult that makes a difference in that child's life. And that could be anybody, not necessarily a therapist or whoever. So, looking at this data, it is kind of like, wow, this is a lot. And, West Virginia, we're going to share a video with you all. We are very high risk. I mean, as you all know, we have we have lots of things happening, but we want to change that. And being part of the ACES coalition is just really trying to go out there and help folks understand what that is. So,
and where those things are important, right? Because we have to know kind of where we're at in order to go forward.
right.
We really want to overcome ACEs. So the biggest thing we can do from it with an ACE score is know that it doesn't define you.
Right.
Okay. So what we want to talk about today, of course, is overcoming those ACEs scores and also focusing on destigmatizing the trauma conversation.
Right.
That's, come. So
yes.
yeah.
So definitely, I think that these, destigmatizing trauma, in Appalachia, as most of you all know, I mean, my mom, I'm just going to use her as an example. She grew up in an abusive home, pretty abusive. I mean, she's 83 years old now, and no one ever asked her how she was doing. All those things were kind of kept behind closed doors. You didn't talk to anybody about it. You couldn't tell somebody. So, we have generations of folks like my mom that are raising these kids, and we have to be able to have those conversations. And it's not easy conversations to have, but secrets keep you sick. That's what we always like to say. So we're trying really hard to help our younger population and our parents. Again, like I said, in a school system, we're always been kid focused, but we really need to help those parents heal. I think somewhere like down the line it said, forgotten children become forgotten adults, so we really want to try our best in our school systems and collaborate with outside agencies like you all to support our children and families. So we're going to delve in to my favorite part of the training, is to how to overcome this. That's what we want to do as providers and community for our students.
Yeah. So we want to look at how we overcome that. And a big piece of that is protective factors. We know that having some of those things that you were mentioning a minute ago are really important to anybody's life, not just a child's, but to overcome and feel safe and stable in your relationships and in your environment. We want to really teach our students resilience and what that looks like, at least in the school building during the time that we have them. So how can you help?
So protected factors are characteristics that are associated with a low likelihood of negative outcomes. Protective factors may be seen as positive countering events. So I really like this next slide, and we're going to share these slides with you. It's like, how can you help folks have protective factors? How can you help children have protective factors? How can you help parents have protective factors? So I love this slide right here. This was put out for the Center for Study of Social Policy. And it really kind of goes into everyday actions that you can do as a provider, what protective factors that those create, and then the results of those. So for everyday actions, demonstrating ways that parents can be valued, honor each family's race, encouraging parents to, manage their stress, support those parents as decision makers and help them to understand, to be a buffer for their child during stressful events. We have a lot of kids, especially our juveniles, they're kind of being the parent. So they're kind of like doing all these things. So those parents don't have that resilience. So helping those parents be empowered is a huge thing. And that's going to help strengthen those families. With social connections, helping those families build and sustain useful social connections, creating inclusion, facilitating mutual support, and promoting engagement in the community. This is something we really, really do big in the school community. And we have a student that Natalie and I sit down with, and then doing our truancy diversion plan, we try to get them, how can you be part of this school community? Are you interested in art? Are you interested
to get into
in ROTC? What do you want to play football? So having those social connections is a huge protective factor, and it's pretty easy. It's kind of common sense, but it really does help.
Yeah.
The next everyday action would be helping to model developmentally appropriate interactions with children. Some parents don't know how to talk to their kid.
And I think that's huge.
That is very huge. And especially with our grandparents raising grandchildren, it is completely different. It's like night and day, the way things were when they were young. So helping those families interact with their children, providing parenting. This year with Kanawha County, we had a new website launched, parentresource.org, and you can go on there and get free coaching sessions. If you're having a problem with your kid using their cell phone too much, just those simple parenting skills. And anybody can have a baby. Nobody really gives you a book on how to be a parent. You can have a book on how to drive a car and all this stuff, but nobody tells you how to be a parent. So if we can help these parents understand child development, things like that, it'll help with optimizing that child development.
Right.
The next thing is responding to families when they are in crisis. And as most of you know, a lot of our families are in crisis. A lot of times, I feel like sometimes, we are so busy putting on Band-Aids. I love this approach that we're changing now and what we're doing, because I feel like we're not going to be putting as many Band-Aids on, because we're going to empower these families from the beginning to help them. Providing them with information from the community, helping them to develop those skills. I think for years and years and years, I've been a social worker, and I mean, it's so easy for me, if the family needs clothes, yeah, I can get those. I can go get you some groceries. I can go get your child a pair of shoes, but we have to learn to empower those families to help be their own crisis support is huge.
Yeah.
That's a huge thing. And that's going to help with that child development and, a less likelihood of child abuse and neglect.
And I think another thing too with the social and emotional competence, I think this is kind of hard. Going back to what you said before, that like when your mom was being raised, nobody really talked about the feelings the way that we do now in society, or that we're trying to. So we're trying to break that. And one of the things that you can do is help parents foster that emotional development, helping parents really ask their kids, how do you feel about this situation? What is going on here in these situations? And model those nurturing support to children. Like, what should this look like? At least we can give that to you here at school, and include children in their own development in activities, and put that into the what you're doing with them. So help them develop a positive cultural identity is huge. I mean, we're in Kanawha County, and there's lots of different cultures here, but I know that exists in other places in West Virginia too. So how are we tying our students and our children back to their culture, and respond proactively, when you have the development seems to need support. So how do we support parents to support their kids in that endeavor? Okay. Those are some good ways to do that every day.
So yeah, so resilient, so this is a great way to overcome ACEs. And it seems like I said, sometimes things are just like common sense. But they can definitely put those protective factors in. The next part to overcome ACEs is to develop a safe and stable nurturing environment and relationships. And this is like huge for our school setting. A lot of times, summertime as a school social worker scares me because I don't know where my kids are. I don't know what they're doing. I don't know if they're eating. I don't know if they're okay. A lot of times, students a school is the safest place for them. So we want to make sure that our environment is safe and stable and nurturing. We have had schools, we have had kids, I have had kids personally that I've worked with that, I'll just give an example. I worked at Riverside High School for 6 years. I'm from that community. We have a lot of poverty. We have a lot of families that don't value education. We have a lot of drug use. We have a lot of we have all the things up there. So I think 2 years ago we got an options pathway program, which has helped students get their GED and they get to graduate high school. And it was our first year, and we got 30 students in there, and they were basically the students that were in truancy court. They were, on probation for some other juvenile issue, whatever. And the teacher that taught that class, she was just absolutely amazing. It was one class, they went in there, they felt safe, they weren't out, failing, they felt success. And like our first year of having that program up there, out of 30 kids, 29 of those students graduated. So one of the students, she posted the nicest thing on Facebook afterward, and she said, I would have never got through if someone would not have taken that extra step to ask me how am I doing at home, what do I need, and help guide her in that direction. So that safe, stable, nurturing environment, that might not be their home, that might be the school or the community, wherever you're at, might be that place for that person. So that the CDC even says that those relationships can help those children reach their full potential.
Yeah, so and you kind of just went over this too. But I think the one key thing from that example was just the consistency.
Absolutely.
Right. I think, yes, creating that safe environment with that teacher, but I think that those students, because I see those classrooms all over the whole county. Those kids are like, that's my teacher, that's my class, those are my friends and
people.
my things, and this is what I know, and I know that I'm okay there. I know that I'm safe in there, and if I had a bad night, I can talk about that without being judged or without being thrown out and sent to the principal's office or whatever. And it really does give them that space to be nurtured by that adult relationship, the positive adult relationship, be safe, and just be consistent and predictable in that area.
Absolutely. And the stability of all of that is great. It really, I think last Christmas break, we were off for Christmas break, and then I think we had like the blizzards and everything. And like our kids were so happy to be back in school because they wanted that stability. They needed that safety. They needed all of that. So just think about that a lot when kids are out of school. Okay. So resiliency building, I'll go ahead and let Natalie talk about that.
Sure. So when we think about resilience, it really just means adapting to, our life afterwards. So it's the capacity to recover from adversity and pursue goals despite the challenges that you've been through. So it helps you survive the worst days of your life and thrive every day of your current life. With appropriate support, even those with high ACE scores can still thrive every day and still lead great lives. So that was just their definition of it. But resilience, of course, trumps all of our ACE scores. So when we have built resilience ourselves, and when we're helping these children build resilience through those connecting relationships, it can really impact how ACE scores are shown in our adult lives.
Exactly. And, I have, worked with lots of different children who've been removed by CPS, have had the same level of abuse. And, some kids' resiliency is, the kid could be in the same house and have the same thing happen to them, but just these other kids' protective factors and their resilience is different, and they're gonna, react differently to the same situation. So kind of be aware of that as well.
Sure.
So resilience is made up of several different things. It's your executive function, your character strengths, just your interpersonal skills, patience, grit, positive emotion, and those attachments. So, like I said, every person has a different personality. Every student has a different, might have a disability. They might have ADHD. They might have, mental health issues. So when you're looking at resiliency, it's made up of lots of different things, and everybody is different. So it's definitely not a cookie cutter approach.
And I think this is another reason why it's important to know your kids.
Absolutely.
It's important to know your students that you're working with, or your clients, or whatever you call them in your agency. But these kids, because they don't have the same personality.
Absolutely.
And maybe that's a way that you can help them build that resilience in that area.
So this is the Dr. Ken Ginsberg. He created the 7 C's to building resiliency. It is competence, confidence, connection, contribution, coping, and control. So when you're looking at that, with your adolescents, your students you work with, look at all these 3 C's to help them kind of get that resilience built up.
Yeah. And Dr. Ginsberg, he was the co-founder and director of the Center for Parenting Communication at the Children's Hospital of Philadelphia. So they did a lot of great work up there, researching all of that. So I think that's really great when we're able to work with those.
So what can you do in your role to help individuals build resilience? So I really love this. We got a lot of this information from the ACES Coalition. So this is called a resilience score. And you can kind of ask your students or your families or your whoever, I believe my mother loved me when I was little. Even kids that we've had who have been abused to no end, their parents love them. They love their mom. They love their dad. So looking at these different things, when I was a child, there was somebody in there that, helped me. There was a coach. There was a teacher. There was a neighbor, so, it might be the secretary at the school. Just different things like that can build that resilience score. So I love this screening tool. You can use this tool to work with your students or your clients. I'm sorry, I always say students because we have students with your kids to see what that resilience score is.
And the last one here, I think, is really super important, because I know we're talking about students and kids, but we're also talking about you. And are there people that you can count on in your life right now that can be your support?
Right. Yeah, I mean, I'm going to go back to my mom's story. I'm sorry, she'd probably kill me, but that's okay. So my mom, had lots of brothers and sisters, and some of them have all passed away except one. But my mom, I feel like looking at this, had a good resilience score. She had my dad, she had his family, they cared about her, they got her out of that situation. She had an education, she had one of her favorite aunts. We go back and talk about this, all the things, and she ended up being okay. Yeah, she had trauma, but some of her siblings, not so much. They did have some other issues. They did have some issues with addiction. They had some other types of things. So I just kind of look at this with my own family, the things that my mom had and the things that her siblings didn't have. So that kind of hits close to home. So thinking about this, like I said, when you're working with yourself, when you're working with your clients, when you're working with your parents. So those are who are resilient. They, have concern for others. They can accept what they cannot change and focus on what they can. They have a meaning, they have a purpose. They have a social support, and they can support others. So like I said, I can see the kids, that had basically had nothing, but they were resilient. They were the kids who, probably did, we were probably sending food home in their backpacks on Friday, but when we had a food drive, they were bringing food back to us and putting it in our food bag. So I kind of think over the years of students that we've had, and those that are resilient, those who did overcome, kind of the things that they have looked at.
And it gives them a sense of purpose.
Right.
You know, and I think that's important
It is
to
a
build.
purpose.
Yeah, and it makes them look for meaningful opportunities in their own life too.
Absolutely.
Yeah.
Like I said, a lot of our kids that we've worked with, with going into court system, and they just don't have hope. So, having a positive outlook, in life, that is just such, if you can give a kid hope, I think that can just open up so many opportunities for them,
Yeah.
for sure. Yeah, and a lot of times, especially after COVID, I think kids were so isolated. We just saw such an increase with mental health issues and
Yeah.
anxiety and all of that stuff because they were so isolated. They were probably already having childhood trauma anyway. Then they were like taken away from the schools and taken away from those things. So I feel like this year, just personally, I think we've overcome a lot of that
Yeah.
with our students, and we'll share what kind of we've done here in a minute. But um, definitely the hopelessness that we've seen has kind of started to go away some.
Yeah.
I mean,
yeah, we're
I
definitely
don't-
making headway.
I
for
definitely
sure.
making headway for sure.
But they have the moral compass is they have a feeling, a knowing of right and wrong. And the last one, a belief in something greater than themselves, that can be, and a lot of times is through some type of religious or spiritual practice, but it doesn't have to be. It can just be through community and
Right.
knowing that something is higher than them.
Right, exactly. So this is ways that how can you help? I think most definitely, you need to, like, how can you help yourself? So like I said, a lot of us in this profession, I feel like have been led here because of your own personal experiences, maybe. So definitely developing a healthy, positive view of yourself. And that's hard sometimes. Just looking at yourself in a positive way. Practicing self-care. Natalie and I were talking about this a minute ago about she's in a class and we were talking about self-care. Some people think, yeah, self-care is just going to get a facial or a manicure, a pedicure. I mean, yeah, that is kind of self-care, but not really, like really, really self-care. That's kind of listening to music and, exercising, taking care of your body, taking care of that. Seeking outside help with a counselor or therapist. I think everybody needs therapy in my opinion, but spending time with people who lift you up, getting involved with faith-based, helping with community, kind of like practicing an I can overcome attitude when a crisis does occur.
Yeah.
Um,
Yeah, kind of check the attitude.
Check
of,
the
"Oh,
attitude."
this is horrible. It's never going to get better. Why does all this happen to
Right.
me?"
Like, I think you can overcome those types of things, but it's almost like a self-talk thing. Um, I've been around people that are just I don't want to say Debbie Downers, but it's just like glass half empty all the time. And I think we have to look at, the glasses, look at optimism, doing that and learning how to love yourself again, just by being you.
Yeah.
I mean, just because bad things happen to you doesn't make you be a bad person. That does something that
Yeah.
does not define you. And I think a lot of times folks who have, been victims of abuse and neglect feel like it's their fault, and it's so not.
Yeah.
And just being able to love yourself again is just a huge aspect of that.
Yeah, and I think too, the way I always think about it is if you were your own client, what would you want you to do?
Right.
How do you practice what you preach? And I think that's really important because we can't truly serve and be there 100% and give space for others when we don't give that to ourselves. And we can lie to ourselves a lot about it, right? Like, oh, I'm fine, or I'll be fine.
Everything's fine, yeah.
But really, I mean, and you all know that, right? Like being in the helping profession, it can drain you sometimes.
Right.
But how are you making space for yourself so that you can make space for your people?
Right, exactly. 100% with that. So how can you help the children? Model that calmness and resiliency. I can think of a situation. I'm using examples just because I think they're funny, and I like to use, when you work in a high school, you're gonna have fights.
She broke up a fight once.
I've broken up lots of fights, but I can just recall this one. This one fight, it was lots of kids involved, and I'm trying to like calm the sister was like trying to go fight this anyway, it was a whole thing. Everybody was like wound up. So I brought the person in, brought the sister in, we're calm, we're good. we're good. I think, were you
Yeah,
there
I
that
was
day?
there
Oh,
that day.
yeah, Natalie was there that day with me. We're good. We're great. You know, everybody's calm. Everybody's kind of debriefing. Well, this great colleague comes in. Just the like energy,
Yeah,
because he was
off the
kind of
cuff.
wound up too, because he was kind of, well, what's going on? What happened? Did it immediately, like,
The kids are like,
you know, all of our work like was out the window. So our principal was like, just go, they've got it, everybody's good. So kind of like looking at that calmness is very
Yes.
important, like checking yourself, checking your feelings.
and sometimes that's hard. I mean, if any of you are parents, gosh, when your kid throws a temper or is
Yes.
getting loud with you and you just want to do it right back, I mean, you know, modeling that calmness is giving them a mirror to go, oh, this is what I'm supposed to look like.
Right.
This is what I'm supposed to
This
do.
is what I'm supposed to. And
You
it
can
is,
do it, I can do it
it
too.
is very hard as a
Yeah.
parent. But anyway, that was just kind of a funny.
It was.
I mean, it wasn't funny, but it was kind of funny.
Yeah.
And focus on what's working. You know, like I said, every child is going to be different. Every child is going to, you know, respond differently. They're going to like different things. So focus on what's working for that child, and individualize that. You know, creating soothing spaces. That's something we really did big at Riverside. When I was there, we got a grant and we kind of created, we called it the Warrior Oasis, and it was just a place where kids could go when they're having a minute. They can, and teachers and staff and us, kind of a place where we could go and kind of decompress and
Just
listen
be.
to some music and just have a place. So kind of creating those spaces for your students and clients. Definitely encouraging hobbies. And having open, honest conversations with people. You know, sometimes people don't like to talk about the elephant in the room. You know, I've always just been a practitioner that's just been real and open with people, and kids appreciate that. They don't want you to lie to them. They don't want that.
Well, and sometimes you're the only one that's willing to talk about it.
Right, exactly.
Talking about
So,
destigmatizing all of it.
right. And then just building a hopeful vision of the future. You know, I think in schools, you know, people are like, well, you need to go to college, or you need to do this, or you need to, not every child is cut out for college, you know. So, you know, what is that student interested in? Do they want to go to career school? Do they want to go to the military? Do they
And
want to,
encouraging those things.
do
that
they
they're
want to
interested
go
in.
work on the mines? Do they want to go work on a barge? So having those visions and that hope for those students is so huge, and that's going to build resilience and help them overcome those ACEs. So this is the exciting thing. Again, I got this job last July 1st, and the law in West Virginia changed as far as what truancy looks and what chronic absenteeism looks. What we had always looked at as attendance directors is truancy. So truancy is if you miss 10 or more unexcused days. And, you know, that's kind of what we were doing, focusing on that, this and that. Well, the State Department legislature said, well, when students are not there, excused or unexcused, they're not getting instruction. So they changed the metric of what we are actually looking at as far as attendance. So we still do truancy, but we also look at total absences for students. And that's kind of what the law has changed at. So after COVID, the chronic absenteeism rate has just skyrocketed. 5 to 7.5 million students are chronically absent in the United States. Students who live in poverty are more likely to be chronically absent. You know, as kids get older through middle and high school, it usually increases. It increases with kids in minority and kids with disabilities, foster children, homeless children, all these things. So looking at all of this is our students who have high scores. These are our students that have adversities. And again, like I said, we were looking at truancy is 10 or more unexcused absences, but the law says if you miss over 10% of your school year, which is 18 days, that's the day, we have 180 days.
Excused or unexcused.
Excused or unexcused, you're considered chronically absent. So last year,
just a little more than a fifth.
Yeah, 21.6% of our students in Kanawha County were chronically absent. That's a lot. That's a lot of seat time where students aren't getting instruction, where they're not getting nurturing environments, where they're not getting social emotional help, where a lot of them are not getting health care because we have healthcare centers.
Yes.
So this was a big problem that we are working on.
It's a marathon, not a sprint.
Yes, it's a marathon, not a sprint. So our superintendent kind of charged me and our state department and the legislature, like, what are we gonna do about it? How are we gonna change it? So we have basically, I like to say, rebranded our entire job and what we're doing in the Office of Attendance and Social Services. Um, so basically, how to build a culture of attendance. And after COVID, people just stopped coming to school. I mean, all the time. So they just didn't want to come. You got a snotty nose, you're not going to come to school. You got a little headache, you're not going to come to school. So what we had to do is kind of change and build a culture of attendance. And what does that look like in our county? So first of all, you have to define that goal clearly. Regular attendance is 9 days or less per year. So that's 95% of that. That's the goal. That's the high goal that we're going to. No more than 9 absences, excused or unexcused. So what we have tried to do really hard is to kind of keep that goal in mind and educate families, because in years past in the legislature and the law, you could get an excuse for anything, vacations, so many things
Yeah,
were excused.
2 weeks off for strep.
2 weeks off for strep,
everything.
all these things. So the State Department and the legislature have really tightened down like what is excused, and it's not very many things. So we are really trying hard to kind of market the new law and keeping that goal in mind. So we've done videos and sending magnets home, just different school level activities to help create that culture of attendance, and having the teachers be part of that as well.
Right. And I think that's a huge thing, and we'll talk about this more a little later, but what we have found, even just in our about year and a half of doing this, is that it really matters who's on your team.
Absolutely.
We've got to have people behind this 100% to promote attendance, because it helps all the way around, like you were saying. But even from a teacher's perspective, it helps their grades and their test scores, and if we need them on board to support students as well.
Right. Exactly. So, we want to really focus on prevention and intervention. So we look at the multi-tiered system of support. We're going to go through that. But, like in the past, truancy court is like the bypass surgery of our world. So if you would go to the doctor and you would have like high blood pressure, you would definitely not go in and have an open heart surgery. They would start you maybe on an exercise plan or a diet, or maybe some medication might be the next level. So truancy court is like the last thing that we want to do. And really over the years, finding a family who was in crisis and trauma, getting them into court and getting them a fine, how is that really helping them?
Right.
So that is the last ditch effort that we like to do. We really are trying hard to drastically reduce the numbers of students who have to go into the court system, or families, and focusing on the preventative proactive measures, and developing and implementing a multi-tiered system of support at your specific school. This is very important because, like I said, Kanawha County is huge, and we have lots of demographics here. We have rural, we have inner city, we have neighborhoods. So when you're developing the system of support, it needs to be very school specific. I can't tell, what we do at Riverside might be completely than what we do at George Washington High School. So this is kind of what we've been trying to do this year, is educate principals and teams at schools on what does your plan look like at your school.
So one of the things that the law required was this tier system, or multi-tiered systems of support. And the way to think about this, if you've never heard of the tier system, is everybody gets level 1. Okay, everybody gets the universal tier 1 supports that we put in place. So these are our school-wide, community-wide supports that we put into place, where we're engaging on that school climate, changing the school climate, having our teachers and everybody involved on systems level, rewards systems level, everything that we can do on that community basis, and everybody gets it.
Right.
Then if we still have students who might need a little bit more support, they still get our system, our tier 1, but they also get tier 2 supports. And this is very personalized outreach to that person. So, what does Johnny need that maybe everybody else doesn't need because he has a special situation? And making an action plan to address those barriers and putting caring mentors in place and what that looks like. So, when we have everybody getting tier 1, we really only want to have about 10 to 19% getting tier 2 because we want really the tier 1s to be amazing and really catch a lot of students and the needs that they have in that school. If we have more than 10 to 19% of our students getting tier 2, the tier 1s, we need to reassess them.
Exactly.
So of course our tier 3, what Kim was saying earlier, is this is like a very small percentage of our students should be receiving tier 3, and this is really more of our legal intervention and
CPS intervention.
yes, and all of those high systems level interventions that we have with families. So we really, I think as a school system, and I'll just say at least for Kanawha County, I think we spent so many years focusing on tier 2, I think, yes, but tier 3 that we were top heavy, right?
Yes.
And so it was like, where we have done so much work building this tier 1 that we have seen a huge increase this year on our, not only our attendance, but the well-being of our students.
Absolutely. So, like Natalie said, we can really catch the majority of our students with tier 1. And with tier 1, like I said, each school is going to be like different. Each school, again, I'm using Eastern Kanawha County for an example. We found that in our school that we had a lot of students who didn't have access to washer and dryer. So, our school decided to buy a washer and dryer. It's there. Parents can come. They can wash clothes. Kids can wash clothes. So that for Riverside
It was huge.
that is a tier 1 service because everybody can do that if you want to, if you need to. So every school is going to be different. So that's why it's so important to individualize those. Tier 1, like I said, it'll look different in every single school, and that's going to help all students.
Mhm.
Again, with your tier 2 students, that's going to catch some of them. And we have worked really, really hard. I'm so excited. When I got this job this year, I worked so closely with our lead school nurse, our lead school psychologist, and our director of testing and counseling. So what we have done in our county, and this is kind of unique, what we have done is each month we have we're doing a collaborative approach where we all meet together, and it's almost kind of like a hospital triage. That's kind of like what I like to think about it as.
Yeah.
So like we're in here and like we're meeting, we have them meet twice a month and kind of do like a staffing on kids. So if I know, okay, Johnny is diabetic, his sugar's messed up, he's missing these many days. Okay, the nurse is going to take care of them. Mary, she needs, her families need some housing. So the social worker is going to do that. So we're kind of doing like a staffing and a triage. So everything is not all on one person doing it all and us trying to figure out. So this collaborative approach has been absolutely phenomenal.
Yeah.
We've even got to the point where we're doing like our staff meetings together, we're doing joint trainings, and doing data collection, like what is happening with these students, tracking them, all of these things. So it's been pretty impressive this year and monitoring.
And two, that trickles down because I think before we worked so much in silos.
Oh,
Like,
absolutely.
oh, that's them and
That's
them,
not,
that's them.
yeah,
And now it's like, how can we do this together to make it better for everybody who's involved?
exactly.
And we have seen just so much success.
So much success. It's been a really great year. So again, the tier 2 and I want to reiterate too, we don't want to say, well, that's a tier 1 kid, that's a tier 2 kid, that's a tier 3 kid. We're not putting kids in these boxes. These are interventions. So just be cognizant when you're doing that. We're not labeling kids, we're labeling interventions.
And on that line, I mean, students can be in any level of that
Absolutely.
support too. Yeah.
And then again, the next is our intensive, and this is going to be very few. This is going to be very few students. Again, we have noticed. I'll go through our successes in a minute, but these are the students that we're going to be reaching out to your agencies for help. We have so many great relationships with our partners in Kanawha County. We have MOUs, we have counselors coming into the schools, really trying to support these students and families. So this is going to be very few students. And again, these are the students that might have to go into the judicial system to get some extra help. Parents that might have to do that. And a lot of those parents do need extra help. They might need CPS involvement to get services in the home, things like that. So again, all the students has received the supports to get to school regularly. Like this was our first year. I think we had huge success, and we just want things to get better and better next year.
Yeah. And we've already kind of talked about this a little bit, but we have done so much work this year on just creating that culture of attendance. So what does that look like? And using that common language so that not only our school professionals are aware of what are we talking about here, what are we addressing, but that our parents and students are knowing what that is as well, which obviously leads to a common understanding. Rituals, some of our schools have really come up with some really cool stuff this year as far as what they're doing with attendance. And if you have questions about what that looks like, we can give you some great ideas. We just don't have the time to do that today. But the goal and the thing is here is that everybody's working together. So between the cook and the principal and the bus drivers and our social workers and our teachers, everybody's on the same page working for the same goal, the betterment of our students.
Exactly.
So this is just a little bit about what our attendance teams look like. Obviously for elementary school, it's a little bit different than our secondary schools. But kind of like what I was just saying, that we're just want everybody on board, no matter who you are in the school system.
And again, like in the past, and not to anybody's fault, that's just the way things have always been, well, that's the social worker's job, or that's the nurse's job, or that's the counselor's job. We have seen such success when the administrator is on board and everybody is on board. It's just made a world of difference. I can look at our data and I can tell you this school's doing it this way, and look at their
Absolutely.
percentages.
We can see
So
it.
we can see it. I mean, 100%.
And in those schools where they're maybe not doing what some of the other schools are, we hear the same things. Well, it's not my problem. It's
Right.
not, we've done everything we can. And it's like, but we haven't. And so we need to get away from saying, sentences like that. So, or even that attendance is not as important as X thing, which, I mean, I know a school, is there for academics, but you can't get academics if you're not there. So it all just ties together. It all ties together. So working as a team is most important.
Again, we talked about parent ACE scores earlier. I get so mad. I mean, I'd still get mad when, looking at parents in a negative way. Well, that parent, they're the problem. They're the whatever. They're never going to change. Again, we have to focus on the positive. Focus on those parent relationships. A lot of those parents, maybe they were high school dropouts. Maybe they didn't have a good. So it's kind of building those relationships with those parents.
Yeah.
I used to laugh all the time. Some of my court friends, and I've always kind of done this as a practitioner. I've always been in my community. I've always had relationships with my parents, with my students, being at the school, eating lunch with them, opening the ketchup packets, and one of my principal, well, actually, our deputy superintendent, she said, "You're the only person I know that took a parent to court and they hugged you when you got there," because I developed that relationship with them.
Yeah.
Knowing that you're there to help their student can just go leaps and bounds. And focusing on the positive is huge.
Yeah. So next steps, and I know that not everybody on this training is in the school system, so I kind of want to talk about this in just ways that you can support the kids that you're working with, is develop a team. Okay, have a team approach to this, and create a good culture. Support attendance. So do you work for CPS? Are you supporting your clients' attendance in their situation? Do you work for, are you a therapist? Are you talking to your clients about attendance and their school performance and how they feel in their environments there at school? But engage community partners. This is huge because, like we've mentioned before, every community is different. What that looks like, who's important, who needs to be involved, it's all, community based. So get those people involved. And if you're not from somewhere, ask somebody who's been there for a while. Walk the streets, get to know somebody, talk to some people, go talk to some parents. And look at your data. I'm not a super big data person just because I don't do numbers, but it is important. And when you start unpacking the data and the things that you can see, you can see how you can compare that and see what progress you've made, but also see maybe where are some ways that you can make a difference.
Right. And looking at trends, looking at communities, what has happened, so data is huge. Like I said, we always joke all the time, we're social workers, we don't like to do math, but that's okay. We do look
But
at
it's
our,
important.
it is very
It's very
important.
important.
So, and I just think, remember, decreasing this is a marathon, not a sprint. I think people are like, are quick to give up and like, well, I'm not gonna, it's not working, so I'm not doing it anymore. We have made, gains this year. It's, I feel like it's pretty great, but, we're just going to keep getting better and better. So, some of our successes for this year, which I'm super proud of, the collaboration with our student support staff. I mean, that has been amazing. Like it's such a breath of fresh air to be able to come and talk to my colleagues, even at a board level, and then that's trickling down to our school level. So that has been awesome. I'd like to report our chronic absenteeism rate has decreased from 21% to 17 point
In 1 year.
in 1 year. So we are pretty proud of that goal. It's under the state wants us to be under 20%. So I think we're there.
Yeah.
Based on my numbers of Weavis, I don't know how things always work out. That's what
We'll take it.
That's what it
Yes,
said
it
the other
is.
day. We have decreased our court petitions. The courts are backed up. I don't know how some counties are, but our courts are backed up. So we have decreased those petitions. We've increased our community involvement. Our test scores in Kanawha County have increased this year. Our staff and student buy-in, and our collaboration with outside agencies. We've got so many amazing partners and MOUs that we've created this year, and we just look forward to having those relationships get better and better. So I'm gonna kind of show you this video, and I'm very proud of this. This is Overcoming ACES, and I'm gonna try to share this really quick.
You want to keep talking?
This is a video and it's about 21 minutes, but our call to action to you today is what can you do? How can you, share the ACES mission with your community? So this is a great video, and my daughter was part of making this, so I'm really proud of her. And she's in it. She's the principal in this video. So this is a video that can be triggering. There's some real life stories here, and we just want to be sensitive of that. But this is an educational video that you can share with your group, and it has some real stories, and there's some fictional characters here as well that you can do. So we're going to watch this video, and then it's about 20 minutes long, and then we will have time for some follow-up after that. So enjoy the video. Can everybody hear it okay? Yep.
Okay, it's frozen on the screen. You do hear some noises in the background.
Sorry. I'm gonna try it again.
It worked earlier. Oh, this looks more clear. Maybe it'll.
Okay, is it good? Okay.
Won't touch it.
Hear it, but the screen's not changing.
While West Virginia has one of the most majestic landscapes.
I'm sorry, guys.
Your screen sharing is
It
paused.
worked earlier.
Hang on a second.
Here, just stop share. We'll just redo it.
Hang on a sec.
Share sound. Optimize for sharing. And then would that make a difference? I don't know. Here we go.
Maybe if you, share your screen from YouTube.
Yeah, that's what we were doing.
Landscapes in the nation.
That good?
It
There we
also
go.
possesses a deep-rooted problem that is destroying our people. By learning more and working together, we can overcome.
Adverse childhood experiences are experiences that happen at any point from the time a child is actually still in the womb all the way to age 18. Things like abuse, neglect, someone in the household using drugs. As these categories accumulate, it leads to more risk for a poor outcome in adulthood, like risky behaviors, starting to smoke, using alcohol, using drugs, including intravenous drugs, IV drugs, like heroin. Poor health outcomes, heart attack, stroke, diabetes, risk for cancer, the major causes of early death.
Since West Virginia has the lowest life expectancy in the nation, it's likely that we have one of the highest overall occurrences of ACEs as well. In West Virginia, we've had some recent research that shows at least 17% of our population has an ACE of 4 or higher.
Daily life for me and as a child was pretty scary. My mother was a stripper, my father was a truck driver. He was killed by a drunk driver when I was about 2. My mom quickly became a prostitute. The first time I got high was with my babysitter, without the babysitter realizing like I was a child sitting next to her. She went to pass it to me and everyone kind of laughed, was like, oh no, and they passed it around me. And I watched everyone in the circle, so when she made the same mistake again, I hit it and everyone started laughing even more. I became the child that everyone liked to get high. I was 5 years old. Mother told me one time as a child, she had asked me if I was okay with it and told me that we really needed money and I was okay. Perpetrator came in, he had a big camcorder, he gave me a bath, he had touched me, they took a video of me naked on the bed. To this day I don't know where that video is. It's kind of a haunting thought.
I was given up for adoption at birth, and so that led me here to West Virginia. My mom thought she couldn't have kids at the time, so she adopted me and then ended up getting pregnant with my sister. When we were toddlers, she was divorced. My mom did eventually end up marrying a man, and he sexually abused my sister and I until we were about 9. Things just got worse from there. My mom ended up getting a divorce, but she never pressed any charges, which I had a resent for that for a long time. There were a lot of things in my childhood that made me feel helpless. And so having control of this, not being able to have control of a situation when you need that, just thrive, because I've needed that my whole life. It was heartbreaking and scary.
I remember probably I was maybe in the 4th grade, 5th grade, and their relationship had fallen apart so much that it caused my mother to either be detained and put into some psychiatric help, or maybe she had self-committed and sought help herself. But I remember coming home and mom's not home, and when you think that mom's been arrested or dad's been arrested, you don't know what that means. Do they come back? Do they come back in a year or 10 years? And then obviously, when I was 14 years old and both of them left, and more or less abandoned my sister and I. I remember riding my bicycle a few miles up the road to a gas station. And I remember buying a few cans of soup, and I remember buying some strawberry wafers, like the little wafer cookies. And I took those and I hid those in my bedroom. And I thought, with food there, that I would be okay. So I remember the feelings of concern and despair or hopelessness, and trying to pacify those feelings by going and buying a few cans of soup and some cookies so that I knew that I would have food in the house.
The young man, Quentin, is at a crossroads. Has some indicators that he may have a high ACE score, but that ACE score does not need to define his future.
At 22, I had my first daughter, and her dad ended up using pain pills, and so right before her her 1-year-old birthday, I kicked him out of the house. Years down the road, I do get married again, and I have my beautiful daughter, Charlie, and eventually my husband started drinking more heavily. One day he got physical with me, and then that's all it took, because I remember my adopted dad would do that to our mother when we were kids, and we would vividly remember us jumping on his back and screaming and saying, "Don't hit our mommy." And all I could think about was my daughter seeing that. I was, regardless of how much I always wanted a good family growing up, it was my dream. I was not gonna let them experience what I experienced. I did not want that generational trauma to continue, and I wanted her to know that there are great things in life, and that through hard work that she could achieve that, being an example.
Well, after I was adopted, or after I moved to West Virginia, life was completely different. I moved into home with my great aunt and great uncle, both of them probably late 50s. Both of them had great jobs. It was altogether different than my childhood. And as a result, I viewed it as a fresh start. My adopted mother, Marie, I remember sitting at her kitchen table with her and my adopted father. They said, "You've moved all this way into a brand new community. Nobody knows you here but us." And they shared with me that I had the opportunity to walk into the school and be whoever I wanted to be, and to rewrite my story. And I never forgot that.
When I became a mom that wasn't a good mom. And I realized I'm sick and I need help. It made me realize she's sick too. Like, I had to think about how she was raised and how she ended up the way she is. And then you start getting into generational trauma and how it's just kind of passed down, and it opens your eyes a lot.
Generational trauma is when we have families who may not have dealt with the trauma that they had in childhood. What we know is that patterns in the past can be repeated in the future. Sometimes young people can't identify, or they get confused about their emotions, and then they handle them in inappropriate ways.
Quentin.
Are we talking about social emotional development? What we're really focusing on is the prevention of toxic stress and trauma. And when they're having a difficult time, can they talk to us about it?
Your teachers have been really worried about you lately. They said you seemed really tired in class.
Hey everyone, so today is the day to get some things done. How many of you created a sound recording?
Yeah, my parents have been fighting a lot and I can't sleep.
Wow, that must be tough to not get any rest and then have to come to school.
What we know is that building relationships, communicating, and having positive childhood experiences can balance what they're experiencing that might be adverse.
Hey, remember the other day we were talking about possibly getting you a big brother?
Yeah.
I talked to your parents and they thought that was a great idea. You get to meet your big brother today.
Hey Quentin, I'm Aiden.
I can look back and give names and places, even moments in my life where there was somebody who made such an impactful difference in my life that it changed the trajectory of where I was going.
I think about Mrs. Smith, my guidance counselor. She put me in agriculture education classes, and it was my ag teachers, Mr. Don Stevens, Mr. Jason Knopp, Mr. Jason Millball. They had a great deal of influence over me, and I found that being involved in the FFA and these agriculture training classes, leadership training classes, began to fill a void that the drugs and the alcohol and the running around had left in Florida.
I work a 12-step fellowship that has helped me wonders, and I have a wonderful therapist. She's absolutely amazing. It's Dr. Patricia Van, and I don't know where I'd be without her. She actually showed me an unconditional love that I never had before. And so coming into like a 12-step fellowship, I never really knew what love was.
I'm often asked if there is hope for a child who's experienced trauma. Absolutely, there is hope. The more a child has caring, healthy relationships, the better he is able to recover from trauma. Relationships are a key factor in all of our development, but the real therapy is about human love.
I believe that love is probably the thing that made the most difference in my life. I always felt loved, even in the devolving of my childhood. After I was adopted, my adopted parents exposed me maybe to a new love that I'd never really experienced before. And I began to realize that these individuals allowed me to come into their home, and they're pouring themselves and their livelihood into me when they didn't have to. They chose to. And I'd never really experienced that before. But I absolutely believe that love did make the difference in my life.
There's no perfect outline for raising the perfect child, but we can do some things better if we talk and learn. So once we open ourselves to some different ideas, we might be able to help the child overcome even sooner. Any parent can support their child's resilience by really helping a child understand it's about pushing forward and persevering but also helping the child to see that there's hope for their future, helping the child realize that their life has value and that they have a bright future ahead of them.
I told everyone at the end of last year that this was going to be one of my best years. And so I was accepted into Leadership West Virginia this year. I was awarded 40 under 40 by the State Journal. My biological brother and sister, this year, they found out that who I am, and I got to meet them and hug them and all the things. And so if we just focus on us and the people that we love, we'll have a better chance of meeting all of our goals.
My wife and I have been married for 12 years. We have 5 children, 4 of which are biological, 1 of which we adopted. We're foster parents. I have the opportunity to serve as pastor of a great church in a great community. I have the opportunity to work as a delegate for this county, Mason County, and for Jackson County, where I grew up after adoption. The opportunity to change my life, the privilege to have a fresh start has absolutely came to fruition. And now the opportunity to change my children's life and to break the link in the chain that oftentimes we see.
I couldn't ask for a better life. I have a great relationship with my son. My oldest son's my #1 supporter. I absolutely love my job. It's a blessing to have. I'm buying a house. I have a college education that I continue to work on. This time next year I'll be in my master's. I'm blessed. I have a life. I have a wonderful life.
Although the individuals in our story received the support they needed to become thriving adults, many who experience trauma as children don't have happy endings. Far too often, forgotten children become forgotten adults. It takes a village to repair the damage of generational trauma. It's up to each and every one of us to prevent ACEs and help families heal. Do your part to break the cycle. Learn more about ACEs, build connections and nurture relationships, and inspire hope in others. Become part of the ACES movement in West Virginia. Visit our website, acescoalitionofwv.com.
There we go. Well, we hope that you guys got some information from this video. I encourage you all to definitely share that video with the folks in your community. It's a great tool. I encourage you to also join the ACES Coalition of West Virginia. They have a Facebook page. You can become a member. It's free. It's a great organization. They just had their their first conference last week, and it was absolutely amazing. So, like I said, part of this ACES movement is to educate folks and kind of have that lens on when you're working with children and families, and it can be overcome. Having that hope and having that compassion and helping students and families. So I hope you guys enjoyed our training, and if you have any questions, you can feel free to reach out to Natalie or myself. We'll be happy to help you. And yeah, I think that's about it.
Hillary, were there any questions along the way?
Let me unmute. There was one question that asked for advice about if your student requires therapies. So what
Okay.
advice would you give to parents that have a child with special needs that ends up needing additional therapy outside of school but has to leave early from school to receive those services? That's the only one that I see.
Yeah, and we find that a lot. We do find that a lot, luckily in Kanawha County, we're very fortunate. We have a lot of organizations that have MOUs that can come into our schools so students don't have to leave. We understand that things happen. I think it's like a hard balance sometimes. We don't want students to be chronically absent. We don't want them to miss, but also you want your students to get the help that they need. So we just always try really hard to encourage families to schedule those appointments like either first thing in the morning or later in the afternoon. I mean, sometimes those appointments again are few and far between. I know a lot of our organizations here do like telehealth in in the evenings. So it's a hard balance. We don't want students to not get therapy. That's because they need it. They need that to be successful. So it is kind of a hard balance, but just trying to encourage those families to make those appointments early in the afternoon or morning.
Yeah. And to add on to that, I know that sometimes this year we've had students who have been in like special needs classrooms who have needed like ABA therapy and
Yeah.
things. And that's a little different situation. And I think sometimes those students have been able to write that into their IEPs, and therefore
It is, but it gets kind of tricky.
It is tricky.
Because if it's written in the IEP and then the school system has to pay for it,
Right.
it's very tricky. It's very tricky. I mean, sometimes life, it is what it is. We have a lot of schools in our county. We have one elementary school and they do a phenomenal job. I mean, they are amazing. But they have 3 self-contained autism rooms. And a lot of those students, they do go out to ABA therapy. And, it just is what it is. Those kids need that. So I think you can't always look, okay, well, we're at this number. I think sometimes we get so hung up on like, we don't want to be over to 18 days, and I think that's a hard balance because that is the metric. But sometimes you just have to do the best that you can do and do what's best for that individualized student. So I don't know if that answered the question.
Absolutely.
Maybe not.
I think so. And I think it's going to depend on, what school and
Right.
what county, everything's going to be
I
different.
think at the end of the day, no matter what the situation is, I think the best thing to do as a parent would just be to contact the people at the school so that they know what's going on, see how you can work together as a team to work that out.
I think communication is like absolutely the key.
Because we have a lot of times, sometimes parents will, students are out for stuff that we didn't know about.
Right.
And it's like, well, gosh,
we didn't know that happened.
Yeah.
We could have helped. So I think opening up those lines of communication is absolutely key. That's something that we've also started doing with Natalie's program with Truancy Diversion. We have what's called a school-based attendance committee meeting with students that are getting up to those numbers. Like, it's kind of part of our
We're missing a lot. So what's going on?
Yeah. So something we started this year is we started that same process, kind of like an SAT, to bring those parents in and being part of that school team. And, like I said, sometimes we had no idea, we've had students, somebody's dad died and we're like, well, we didn't know that. We could have totally helped you. So I think trying to have that
or you lost housing, or you moved across to the other side of the county and now you can't get to school. Like, no.
Just having those lines of communication and hoping parents feel comfortable to come and talk to us because we don't, and that's again like kind of our
that relationship,
our branding narrative that we're trying to change. People are like, well, here comes the truant officer coming to take my kids away. No, that's not us. We don't want to do that. So just kind of changing the paradigm shift. That's not what we're here for. So we're still working on that. We're gonna keep moving forward. That's not our goal at all. So yeah, that's kind of our mission to do that this year. So yeah.
And there's one more question that just popped up, and I don't want to answer for you guys, but from what I've seen, it's another one of those. I think it depends on the school or the county, but it's our counseling services provided during the school day.
Yes, we
not
do
county,
that.
but
Yeah, we do have specific MOUs with folks, especially with high school. We ask that those agencies look at a student's schedule. We obviously don't want them, pulled out of trigonometry to
Right.
go get counseling. So looking at electives and lunchtime and trying to be flexible and working with that school. So
We
yeah,
have a lot of community-based health clinics in Kanawha County too, that students are able to just literally walk down the hallway, do their therapy and go back. Or depending on the school, if we don't have that, we can afford space to do something like telehealth, or we have therapists from different organizations come at
Right.
us. So
we're very blessed, since I got this job and worked with other attendance directors in the state. Like I feel like I'm so blessed with all the resources that we have. I just couldn't imagine doing all the things with so little resources. So we're definitely very fortunate in Kanawha County. So
I'm going to plug Mission West Virginia and our Think program too.
yes, absolutely. We love
we have a new little part of our Think education program. Like I said, it's pregnancy prevention, but we do all kinds of high risk behavior prevention and student mental health. So one of our programs we're working on is having coaches. We call them coaches in some of their schools who can meet with students to be kind of a mentor, not offering therapy, but just to be a mentor, so the kids have somebody extra they can talk to, another safe, trusted adult in their system. So we've been working on that program for a couple of years now.
absolutely.
yes.
So help out. Somebody else asked, do you have a template you use to determine ACES scores?
It was actually that first, you can Google an ACES screening. There's a million different ones, but those first questions at the beginning of our slideshow,
I remember. So they will get it. Okay.
Yeah, they'll get it, but you can literally,
it's actual questions. Yeah, there should be 10 questions if you just Google search ACES.
ACES screening tool.
Yes. And they're free. I mean,
Yeah.
so you shouldn't have to pay for anything, but it's a real quick yes, or it's just yes or no. And then all the yeses you total up as a point. So it's, 0 to 10.
Yeah. And like I said, our provider, like Cabin Creek Clinic, that's a provider that we go to. They do that on all their patients. And it's just really nice to understand.
That's great.
All patients, adults, kids, everybody. So,
yeah. So next time you go to the doctor, if your doctor is not giving you the ACES screener, you should say, hey, this would be really cool if you started doing this with your patients, because I think, yes, we're the helping profession, as far as social services, but when we really start to think of that working collaboratively with other professions, they don't always think of a systems perspective like we do, that everything comes together. They're just looking at, well, you have diabetes, let's talk about that. But what are the other things surrounding that? Or you have, just whatever. And so I think it's a great way to start that conversation.
Right.
Yeah. Yes. I feel that in myself.
And definitely, here's the ACES Coalition email. Go to their website. They have great resources that you can share. We just really want to get that word out to our community and folks that this is a real thing and you can make a difference. I think just having that one caring adult is just life changing for a student.
And really seriously, the next ACES conference would be next June.
Next June.
So I don't know if they put information out on that yet, but I will tell you, I went the first week of June. It was probably one of the other than missions conferences, of course.
That you started.
It was really seriously one of the best conferences I've ever been to. It rivaled stuff that I've been to out of state. It was just really, really amazing. That all the speakers were great. So if you are able to go to that, able to have your employer pay for that, you really should look into going to that conference next year.
Absolutely. Any other questions that you can see?
No, someone did share a link though. Hannah, thank you, to at one of the ACES
screenings. Awesome.
Great.
Thank you.
Yeah. One of the worksheets. My brain it is so hot in my office. Can y'all see my hair is melting? My face is red. I'm sweating like.
Well, we appreciate this opportunity for letting
you guys
today. Yeah, so we were
nervous. Amazing.
Oh, good. And
you couldn't see me, but through your entire presentation, I'm sitting here shaking my head, and I know so many other people
got a heart.
were too. It was great information. I appreciate you guys.
Well, thank you guys so much. Y'all have a great rest of your day.
You too. Enjoy your summer.
All right, thank you.
You too. Bye, guys.
Bye, guys. Thank you, everybody, for joining us this afternoon. As well, look for the follow-up email coming up sometime next week, as well as your certificates. And don't forget to check your junk mail because it will come from Simple Search and not from Mission West Virginia. All right. Thank you, guys. Goodbye. Have a good evening.
Bye.